Yes, so an emerging concept in cancer is that of epigenetic alleles. We are very familiar in cancer with mutations that can occur in different combinations within a given patient. And we know that any given patient with AML or other tumors will be composed of multiple different clones of cells with different mutation patterns. And the diversity of clonality is often considered to be bad because that presumably provides the population of cells with more chances to have an adaptation or the ability to evade whatever treatment the patient is getting, especially if it's targeted only to one clone. So that's one challenge that we have in AML and all tumors, but a second emerging challenge is that of a similar concept from the epigenetic perspective. Just like you can have different genes mutated in different cells within a tumor, we now find that you also have sets of CpGs in different tumors that are co-modified in different ways among individual cells. And that actually, especially when those sites or so-called epigenetic alleles are associated with gene promoters, is linked to differential expression of the nearby genes at the same time. So epigenetic heterogeneity in the form of epigenetic allele diversity within an AML patient specimen is associated at the same time with transcriptional diversity and occurs at many, many, many more genes than mutations do. So it's a much more complex and potentially biologically impactful component of the heterogeneity of tumors. We know that it's important biologically because a higher degree of epigenetic heterogeneity or alleloversity is linked to worse outcome. We have found that epigenetic allele diversity is independent of genetic diversity. They do not go together. And so by studying the genetic diversity of AMLs, you cannot infer from that what the diversity is going to be from the epigenetic standpoint. And indeed, the epigenetic allele heterogeneity is independently linked to inferior outcome regardless of somatic mutations or epigenetic clonality. Therefore, it's a new property that is important because it provides, again, cells or individual AMLs with the potential avenues to escape being killed by exposure to any kind of therapy that they would receive. We have seen, for example, that after treatment, the epigenetic clonality is selected for at relapse, suggesting that specific epigenetic states are in fact favorable for patients to relapse their AMLs. And this is again independent of genetic changes in clonal distribution.